Much for joining us this afternoon to focus on wellbeing in schools and to share learning that supports children and young people, and of course also supports practitioners in the field. So absolutely delighted with the interest and the attendance this afternoon. For those who don't know me, my name's Carol Shillabeer and I'm a Chief Exec in Powys Teaching Health Board, and I've been the chair of the Together for Children and Young People programme, and delighted to welcome my co-chair for this afternoon, Professor Sally Holland, the Children's Commissioner. We'll be hearing from Sally very soon. But I just wanted to start the event by saying welcome to colleagues from across the academic world, the clinical world, social care, education and third sector, as well as parents and carers too. I hope this will be a really exciting opportunity for us all to be around this same virtual table. So far we'd have had to get a very big room to have fitted us all in. So the use of technology in this instance is extremely helpful. I'm also delighted that we are being joined this afternoon by illustrator Emma Paxton. Emma will be familiar to some colleagues. Emma helps us to capture our conversations and our dialogue by drawing live throughout the afternoon, and you'll be seeing and hearing Emma at various points through the afternoon as she shares her work with us. This afternoon's event will also be recorded, and we will make that available to all attendees. So feel free, cameras on, cameras off, and if you can generally mute the sound, that will also help with the connections this afternoon and hearing our various speakers. A couple more elements of housekeeping. We'll be using Mentimeter later in the event. Don't panic is the first thing. We have colleagues who will be able to take us through the detail. So there is a link and a unique code, and we'll make sure that you get that. Hang on to that if you can. We've got some breakout sessions later, and that will be very useful at that time. So we'll give you a little bit of tutorial about potentially use a different device so that you can manage all of that. I've talked about the mute. We had a little preview of a radio station just now. It does really help our presenters if we can maintain the mute. And of course, we've got the chat box facility, so please do use that, and we'll try and capture everything that's in there as well. So the good thing is that I don't need to tell you where the toilets are or the fire alarm in these more modern housekeeping, but clearly people will need to perhaps at times slip away and then come back. So please do feel comfortable through the afternoon's session. So I'm delighted to welcome Professor Sally Holland, and Sally is very well known to many of us, and I'm delighted as always to co-chair events with Sally. I'm privileged to have worked so closely with her during her time as the Children's Commissioner. So I'm going to just hand over to Sally for some opening remarks. Thank you, Sally.
Diolch yn fawr iawn, a siwmai pawb. Mae'n just hyfryd I weld gymaint o bobl yma heddiw. It's lovely to see so many of you joining today and the high level of interest in this event. I'm just going to make a very few minutes worth of opening remarks about a whole school approach before we get on to these wonderful speakers that are bringing such expertise here today. So, whole school approach. Well, one thing I've had to discover as the Children's Commissioner is that change takes time. I think we've all had to learn to be patient, haven't we, in our professional lives. And in fact, in the annual report covering my first year in post as Commissioner in 2016, I published the following recommendation to government, which is a formal recommendation the government must respond to. And I said that the curriculum review programme, Successful Futures, on the one hand, should work closely with the NHS's Together for Children and Young People programme on the other to promote evidence-based whole school approaches to healthy relationships, mental health and well-being. And I made that recommendations partly because I was supporting and advising and scrutinising both of those programmes, and they both have great ambitions to improve our wellbeing and mental health offer in education settings. But I felt they would do so much better to bring those two sets of expertise together. By my next annual report in 2017, I said that actually little had changed, and I had written memos for both programmes and letters to the Education and Health Ministers asking for everyone to work together to achieve this goal. By 2018, the Children, Young People and Education Committee had really got their teeth into this issue, and thank goodness for that, under the fantastic chairing of Lynn Neagle. And they had published their Missing Middle report. And eventually the reform of children's mental health programmes and the curriculum reform programmes did come together under a joint ministerial group. And to cut a very long story short, statutory guidance for schools was published in March 2021 on this issue. But at the time and since then, it has risked being a bit overshadowed, of course, by schools' ongoing heroic efforts to respond to the pandemic and to continue in all that they do. So raising awareness of the statutory guidance and getting wellbeing frameworks right will take time. And it's going to be a crucial part of how we support our children and young people to recover from experiences during the pandemic. Now, there's no doubt in my mind that our schools are prioritising wellbeing more than ever, although they cannot do it alone, and we must make sure that our schools have the right support from other agencies around them to do this well. As an office, in my office, we continue to support the involvement of children and young people in developing schools' wellbeing strategies. And in the last autumn term, so the term before Christmas, we launched a special task, we call it a special mission in primary schools, for the children in our hundreds of ambassador schools. And this is what we did. We trained 750 primary and special school pupils on how to scrutinise and how to co-produce their school's wellbeing offer, and also how to advertise their school's wellbeing framework to their peers. And so far, pupils from nearly 50 schools have reported back to us, mainly primaries, but some secondaries have reported back to us on what happened when they implemented their training in their schools. There's so much to say about this. I'm just going to give you a couple of highlights. One thing we did was we brought pupils together into online workshops from different schools in clusters, and each were attended by up to 20 schools. And this proved a really good way to share ideas and inspire others. And I really recommend schools joining together to come up with great ideas together and to involve their pupils in that. I'm afraid, and apologies to any schools that then had a high demand for wellbeing dogs after that sharing of ideas, because some pupils brought their wellbeing dogs to the screen, and of course that all the other schools wanted them too. Some pupils surveyed their peers and then presented their findings to their senior leadership teams and their governing bodies to say, this is where we think things are at in our school now, and this is what we think needs to happen next. And many schools made new plans following the meeting between pupils and senior leadership team and agreed to review progress together. This is a very quick and simple method my office has promoted. I'll put a link to the materials for it in the chat, but I hope it demonstrates the huge potential for the whole school community to work together on wellbeing. Now back to Carol to introduce the rest of the session. Thank you.
Thanks very much indeed. I'm just going to have a very quick look at the sidebar just to say that Helen and colleagues, Bex in particular, will be supporting us with all the technical elements. So if anyone is having a challenge using the Menti session tech, there's a little bit of help there in the sidebar. Thank you very much, Sally, for those introductory comments. You know, I've been in many a digital call where a cat has walked across, or some sort of dog. So I have a feeling that that avenue of well-being will be well used, and we will come back, I know, to some of the the key themes and elements of your introductory comments. From my point of view, of course, as the chair of Together for Children and Young People, this programme is one that was established way back in 2015 as the first part, and then the second part just a couple of years ago. And the programme is now due to draw to a close. And it just seems really timely that this afternoon we've come full circle. And as a programme, we kick-started the work on the whole school approach with colleagues in Welsh Government back in September 2018. I remember the exact venue, and there were hundreds, it felt like, of people in a very small space. So a really vibrant event. And I think at this point now, wanting to consider the impact of the work that's happened since, the distance we've travelled, and how these relationships can be strengthened even further to improve outcomes and experiences of all children and young people and their families in Wales. I'm so proud because so much has happened since those initial workshops on the whole school approach. And you know, not even withstanding the pandemic, you know, so much progress has been made, and maybe the pandemic underlines the true importance and significance of this work now as we move forward. So the ambitions across education in Wales are huge, I know, with the new curriculum, the ALN work and the whole school approach. And it's been good to see the level of focus and some additional investment into education to help to move this forward. It's also a personal and professional pleasure to work with so many colleagues across the different sectors, and I'm welcoming even newer colleagues to the session today, and some colleagues whose roles have literally been created from the work and the investment into the whole school approach. So today's session will bring together the evidence base and how this impacts developments and practice, all with a purpose of looking to develop how we move forward together for children and young people and their families. From my point of view, I'm going to move directly, if I may, into introducing the first of our sessions this afternoon. A note for everyone, really, we've got a lot to get through, really exciting presentations. So we will be trying to keep to time as very best we can. So a little note for our presenters that we will just sort of interrupt 5 minutes before the end, and also for colleagues in our audience, we will take a very brief 5 minutes just to see if there are questions and answers. Please do use the chat function, or I will come to colleagues to raise hands and things. So we'll look to support this engagement as we go through this very busy afternoon. So first and foremost, I'd like to welcome Professor Frances Rice. Professor Rice is going to be presenting on school interventions, and for those of you who don't know her, she's the co-director of the Wolfson Centre for Young People's Mental Health at Cardiff University, a development which has been so hugely significant for our country and for the work that we're all interested in here this afternoon. So very warm welcome to Professor Rice, and I'm going to hand straight over to you. So thank you very much.
Thank you. Good afternoon, everyone. So I am going to try and give a very brief overview of the current scientific evidence around school-based interventions to support young people's mental health. It's a very sort of large and complex literature, so I'm going to take a very particular perspective. So I'm going to take a scientific perspective, summarise the scientific literature briefly, and try and give an overview of some of the key lessons that can be learned from that scientific literature. And I am going to focus on reviewing two types of different perspective, if you like. The first on interventions that aim to reduce emotional problems in young people, so specifically anxiety and depression. And then the second on interventions that aim to promote a more positive school culture, and in so doing have beneficial effects on health and health behaviours. So just in terms of some definitions and outcomes, so the evidence that I'm going to review today really briefly, much of it focuses on mental health problems as an outcome. So these are clearly things that exist on a spectrum, so from mild to moderate and severe. There are different, if you like, classes or categories of these difficulties. I'm going to focus in particular on anxiety and depression, which I'm calling emotional problems today. And these difficulties can exist, not only vary in severity, but they can persist and cause significant distress to young people, their families, and also affect functioning in everyday life, such as learning at school. And at that point, when someone's had difficulties that are persistent and cause distress and impairment, we call that a mental health disorder. This is some data from an English survey of young people in 2017 and 2020. And we know that mental health problems, so this is probable mental health disorders, are really pretty common in children and young people. So in 2017, estimates were that around 1 in 10 children and young people was affected by a mental health disorder that caused distress and impairment. And then, unfortunately, during the pandemic, this does seem to have had an adverse effect on young people's mental health, with this rate rising to around 1 in 6 during 2020. And like physical health problems, we know that mental health problems are more common in particular groups of young people. So there's a socioeconomic gradient where these types of difficulties tend to be more common in children from poorer families, in children who have additional needs, so additional learning needs, who may have neurodevelopmental problems like ADHD and autism, as well as young people who've experienced early adversity. So these are difficulties that tend to be more common in particular groups of young people. And so, as we've really heard in the introductory statements this morning, there's been a lot of interest in how school can be a context to deliver interventions to support young people's mental health. And broadly speaking, the evidence that I'm going to summarise today falls into what we might call prevention approaches. And so there are different types of strategies that can be used. These preventive interventions can be delivered universally to sort of all young people in a particular population, say for instance a particular year group, irrespective of the characteristics of those young people, or they can be targeted and if you like, selected to be delivered to young people who are thought to be particularly more vulnerable to developing these difficulties. So targeted preventive interventions are typically delivered to young people who've got risk factors that we know make them more vulnerable. For instance, children who are in low income areas or have got additional family risks. Or they can be what's called indicated, so where you might target, for instance, an anxiety prevention programme to those young people who already have slightly elevated but subthreshold anxiety symptoms. And these sorts of interventions, I guess, broadly speaking, can be separated into mental health problem prevention programs, and I'm going to focus on emotional difficulties, and health promotion programs, which might aim to bring about systemic changes in the school system that hopefully has beneficial effects on a range of outcomes. So in terms of the literature around anxiety and depression prevention programs, there's a really rich scientific literature. There's well over 100 randomised controlled trials, and these have been summarised in lots of systematic reviews, including a really recent one. The vast majority of the types of programmes that aim to reduce symptoms of anxiety and depression in young people, as well as that aim to reduce the onset of depressive and anxiety disorders, are based on the principles of cognitive behavioural therapy. So that involves things like teaching young people skills around identifying and challenging negative ways of thinking, trying to help them to develop ways of solving problems more effectively, as well as giving good quality information about what anxiety and depression are. These types of programmes tend to be delivered in classroom time during school time, and they tend to last for around 8 to 12 weeks and be delivered in sort of weekly sessions. And what the systematic reviews and sort of meta-analyses show, when you put all that data together, are that there are small but real beneficial effects on rates of depressive symptoms and anxiety symptoms. So for depression, what the evidence shows is that the type of approach where you target an intervention at young people who have risk factors or early symptoms is more effective than when you deliver that intervention to all young people, regardless of their underlying overall sort of risk. For anxiety, though, there is evidence that a universal approach, so delivering to all young people, is associated with benefits. Also, for depression, there's some evidence to suggest that you get better or greater benefits when the intervention is delivered by an external health provider rather than by a teacher. So what are the things that we sort of either don't know yet, or are kind of remaining questions and areas of where the evidence can be built? So the first thing really around anxiety and depression prevention programmes is that we see a drop-off in the benefits in the longer term. So with most interventions not showing beneficial effects beyond 12 months, though there are a few notable exceptions to that. And so that creates the question of whether we really need to be giving people booster sessions to sort of help keep these skills and these benefits going for longer. The other general finding is that findings are variable across different studies and across different populations. And with all research, that is, you know, to some extent exactly what you would expect. And there are a range of reasons for this. So the first is around the quality of the delivery of the intervention and how much it is the intervention that was intended to be delivered. The other is really around the population and the age group under study. So particularly for depression, for instance, there's been a real focus of studies on secondary school age pupils 14 and over. And so there's less known about how effective the intervention might be in younger populations. The other things that we don't know yet and will need further research on are there are particular groups that we know are vulnerable to developing anxiety and depression, such as children with additional learning needs. And the possibility of either adapting content or sort of modifying the approach for delivering interventions to prevent anxiety and depression in these groups hasn't been well studied to date. The other sort of limitation of this type of evidence is that it's very focused on one particular outcome. And so, for instance, you may find that benefits for anxiety, for instance, don't replicate for other types of outcomes. And one sort of interesting potential question for the future, because we know that there's a really strong relationship between earlier anxiety and later depression. One possibility for future research is to consider whether reducing anxiety earlier on could potentially have beneficial effects on later depression, and that's not currently known. So next I'll move on to some studies around the school environment. So there's lots and lots of scientific evidence to show that the climate of a school, including things like school leadership, relationships between teachers and children and between peers, has really important implications for young people's development and health, including their mental health. And probably the first sort of scientific observations on this go back to the late 70s by Mike Rutter and colleagues. And there's very good evidence that how students feel about their school, how connected they feel to their school. Do they feel accepted, valued and respected and included in their school environment? That has protective effects on a really wide range of health risk behaviours, including anxiety and depression, suicidal thoughts, use of drug and alcohol, violence and so on. And so this feeling that young people have of how connected to their school can be very important for their health, including their mental health and their well-being. And so that's led to a real interest in interventions that seek to improve student engagement with school, that being sort of an important social determinant of health. And it's led to things like the health promoting school framework set up by the World Health Organization. That said, we know that school isn't always a safe place for young people to study and grow, and in particular it can be an important context for exposure to things like victimisation, which we know then has enduring effects on health. So next I'm going to describe two really landmark studies that were published a few years ago now in the Lancet that focus on improving school climate. So one based in India and one based in the UK. And so I'll start with a study from India first. It's called the Sahara Intervention, and it's a multi-component health promotion programme. So it involved activities at the whole school, the classroom and the individual level. And it aimed to do four main things. So it aimed to promote social skills in young people, enhance problem-solving skills in young people, provide access to factual information about health to young people, but also crucially to engage the school community in decision making. So to really involve students and give them agency over the decisions that got made in school. It's a really, really large randomised controlled trial. So there's well over 13,000 young people. So it started in grade 9, so when pupils were aged 13 to 14, and the data here are across an academic year. So the intervention was either delivered by a teacher or by a lay counsellor, and that was then compared to usual school provision. And the two really quite remarkable things about this intervention. So the first is that it showed beneficial effects on a really wide range of outcomes: school climate, depression, bullying, violence, victimisation and perpetration, attitudes toward gender equality and knowledge of reproductive and sexual health. The size of these effects was moderate to large, so the benefits were moderate to large. That's quite unusual to find, large effects in a study of this kind, where we know we're looking at complex sort of outcomes. The other really striking thing about this intervention is that it was only effective when delivered by a lay counsellor and not when delivered by a teacher. So then
sorry, Frances, just to say, just a few minutes left, I'm afraid.
So the UK intervention is the Learning Together intervention. It's a similar type of programme, so it's a health promotion programme, and it involved a school action group, so just enhancing decision making, staff training in restorative practice, and a social and emotional skills curriculum. It was a longer study, so across 3 years, and it showed beneficial, real, significant but small effects on bullying, mental health and quality of life. So I need to wrap up quickly. So in conclusion, school climate really looks like a promising target for improving well-being, symptoms of mental health difficulties and risky health behaviours, but it takes time to embed that systemic change and to implement it into practice. It's also relatively cheap to deliver. One observation in lots of these studies is that interventions were not always as effective when delivered by teachers, and there are likely a range of complex reasons for this. Probably, most importantly to do with workload and additional capacity in the system to meet the additional requirements of teachers, but also around clarity of leadership for health promotion and not having to switch roles between pedagogy and other activities. some interventions are complicated as well, and so you may need specific expertise. So just to summarise, this is a really complex area with multiple and sometimes conflicting findings. There's a disconnect between the interventions that are available for people to use and those that are supported by evidence. And Public Health Wales has set up an expert review process to help with that. I'm going to sort of finish off quickly to allow some time for questions, but really outstanding questions around what's the appropriate balance between universal and more targeted provision, and also the need to consider factors outside the school as well as external support that's available where needed. So with that, I will say thank you very much for your attention, and I just want to acknowledge Olga, who's helped with the slides.
Thank you so much, Frances, and there's so much to cram into such a short time. And we do have a couple of questions in the sidebar. That was a really fascinating presentation, and I know that we may not have time for you to respond verbally to them all, but I just wondered if you would be able to put some commentary in the sidebar for us, Frances. So
sure.
The first question is from Jane Reed. How does the increased benefits by an external healthcare provider contrast with reports that young people prefer a known and trusted adult, such as a teacher? Perhaps if we could take that one verbally, I can cover the other two in the
Yeah,
well,
I mean, it does. And I suppose the key thing is we are thinking about exactly what teachers are being asked to do, which will be different in a randomised control research context where they're having to deliver something that is very sort of structured versus perhaps more flexible support. And probably, I mean, I would say that the particular value of teachers may be in supporting some of these more kind of circumscribed and manualised in type of interventions. Great.
So that's not an either or. Actually, there's a role for both approaches in there, I think, is what you're saying. Thank you so much, Frances. And to Tim and to Eleanor, if we, leaning on Frances's goodwill here, to pop in the sidebar some of her thoughts in respect to your questions. So Tim's question is along the similar lines to Jane's, and then Eleanor asks about the age group of children, young people, and are there studies looking at outcomes for different ages? Mm-hmm. Fantastic. Well, thank you very much, Frances. I agree with those comments in the sidebar. A really informative session to get us underway, and I want to use my emoji to thank you in the usual way for that. So thank you very much indeed. I'm going to move us to our next speaker. We're trying to get a lot into this afternoon, and I'm delighted to welcome Professor Graham Moore. Graham is going to talk with us about the school systems, and Graham is a part of the Wolfson Centre for Young People's Mental Health at Cardiff University, bringing this thinking to us all this afternoon. So welcome to you, Graham. Thank you so much for agreeing to participate this afternoon and sharing this thinking with us. So I'm going to hand straight over to you. And as I did previously, I'll just give a nudge when we're getting close towards the end.
Great, Carol, thanks for that introduction. So good afternoon. My name's Graham Moore. I'm a professor in the School of Social Sciences at Cardiff University. I've got strong interest around child and adolescent health inequalities, and I'm working closely with Fran and others on the Wolfson Centre. So I'm co-lead on the mental health in schools work stream within the centre, along with Simon Murphy. I've also been closely involved in expansion of the School Health Research Network across Wales in the past 8 or 9 years. More recently, I've been involved in some of the evaluability assessment work around the whole school approach in mental health in Wales, which I'll mention later. And I'm also part of a new research programme led by King's College London around school experiences and mental health amongst children with ADHD and autism. So today I'm going to be talking about schools as settings for action to improve young people's mental health, and building on some of the things that Fran has said already. And we can think about schools as being kind of complex systems, and I'll briefly touch on some of the challenges that introduces in kind of thinking about how we bring about change within schools. And I'll introduce kind of a brief history of whole systems approaches to health and wellbeing in education and beyond within Wales. In many respects, Wales has been a world leader in kind of systems approaches to health and well-being. And I'll provide some of the kind of policy context, some of which I think Sally has already touched on, for the Welsh Government's new framework for embedding a whole school approach into schools. So, as Fran was saying, in contexts like the UK, which have comprehensive education systems, intervening via schools enables us to reach the vast majority of young people. And of course, there are caveats. Many young people in Wales and across the UK are taught outside of the mainstream school system. Often children taught outside of the mainstream system have a diverse range of additional risk factors, so we need not to lose sight of that and to ignore the needs of those young people. But for most young people in Wales and across the UK, much of their waking time is spent in a school environment. And historically, lots of school-based interventions have just, I think, seen schools opportunistically as a convenient means of reaching lots of young people at once. But to some extent, I think that often does miss the point, because as Fran was saying, schools are in and of themselves important environments which can have substantial positive and negative influences on young people's mental health and well-being. They provide opportunities for learning and personal development, social development, sources of important social relationships. We know, for example, that for children with less support at home, often their teachers become the most important positive adult role models in their lives, and that relationships with teachers can be extremely important for young people's well-being. So I think in line with Ottawa Charter principles, we can see school-based interventions not just being about delivering interventions to children via schools, but the goal of much school-based intervention is to change the system itself in order to optimise the potential health-enhancing effects of the school environment and to limit health-harming potentials. So alongside a kind of growing literature around changing school environments to support young people's health and well-being, we've seen increasing recognition that schools have many features of what's often referred to as complex adaptive social systems, in that they're made up of kind of diverse sets of actors such as pupils, teachers, pastoral support staff, senior leadership teams. The exact compositions of these groups are constantly changing. Each year's cohort of young people will be different to the last. Staff move in and out of schools quite rapidly, perhaps more so in secondary than primary schools. But schools tend to maintain a degree of consistency in their overall ethos and functioning, even as their composition changes. Schools are adaptive in that they're in a continual state of evolution. So the things that young people need to learn in order to effectively navigate today's society are very different to the things I needed to learn when I was in school. So they're constantly responding to changes in their surrounding communities and wider political and economic contexts. Individual schools as systems do have a degree of autonomy, but often there are limits placed upon that, not only by resource and capacity, but by their positions within sort of regional and national systems. And improving mental health and well-being in schools involves kind of interaction across various policy systems as well, including education, health, and other sectors. Sally touched upon that earlier. And some of this probably sounds completely unsurprising to many of you who are kind of familiar with the complexity of schools from your day-to-day work. But I think historically one thing that seems to have been missing from much of the school health literature is an appreciation of just how complex the environments are in which any new intervention is being introduced. And often interventions do kind of fail to achieve much, largely because they fail to be implemented in ways that are sustainable, given everything else that's going on in schools. And I think obviously with the ongoing COVID-19 pandemic, schools have been very much in operational mode, just focusing on the here and now, and just keeping the doors open so they can meet the immediate needs of as many children as possible has been the priority. So thinking strategically about the future has been quite difficult at the moment. And I'm just going to briefly introduce some of the challenges which arise from kind of viewing schools as complex systems from their complexity. And I've mentioned schools are crowded contexts in which a lot is going on at any one time. So asking schools to do more without considering capacity and how that fits with what schools are already doing will often lead to well-intended interventions just washing out of their systems, and the stability of those systems being maintained through a return to what schools were doing previously. And in some of the examples Fran mentioned, we see that interventions which work in improving young people's mental health aren't so much about asking schools to do more, but they're sometimes about working with schools to review and update things that they currently do. So the inclusive intervention, the learning together intervention involved kind of a big focus on changing disciplinary procedures, for example. So understanding how interventions work when they're about changing the school environment is often as much about understanding what old practices are removed as it is about understanding what new ways of working are introduced. And internationally in education, there has also been a tendency for schools to be judged against quite narrow attainment-based criteria. And when a system's under pressure and needs to prioritise resource, there is this tendency that what gets measured gets done. And in England over the last few days, we've been seeing debate around whether schools should be ranked on exclusions to deal with kind of widespread practices of off-rolling children who are likely to underperform in their GCSEs. We're seeing movement away from the narrow attainment focus in Wales with implementation of a new curriculum, more diverse set of core purposes, including more focus than ever on supporting young people to become healthy, confident individuals. And our own work in Wales suggests that health and education aren't competing priorities, and that schools with comprehensive approaches to supporting health and wellbeing tend to do as well educationally, if not better than those which don't. I think researchers have tended to neglect the impact of health interventions on attainment outcomes, and I think that has to some extent allowed this notion of competing priorities to go unchallenged. It's kind of failed to provide assurance that you can focus on improving health and wellbeing without compromising on attainment. I think if we acknowledge improving mental health is an important goal for schools, but the schools have limited resource and capacity, a key question is which interventions should schools adopt? There are a growing number of branded interventions which are often promoted to schools by their developers, and obviously they're generally well intentioned, but Fran's talk kind of emphasised the importance of kind of focusing on what works, but many interventions out there that are in quite common practice in schools have quite a limited evidence base, and even if a good quality independent evaluation has been undertaken, there are kind of challenges in how schools and other stakeholders can make decisions on which interventions are likely to work in their context. And obviously for every ineffective intervention to which schools dedicate resource, they lose the capacity to deliver things which might work. So there is a huge opportunity cost to selecting ineffective interventions. And methodologically, kind of an area of interest for me is kind of implementation science. And we've been developing guidance recently around how stakeholders make decisions on which interventions might work for them and what adaptations might be necessary to fit an intervention with a new context without compromising intervention functions. And we'd be keen to look for ways that might be used to kind of help support this sort of decision making. Another key challenge, and Sally touched upon this earlier, the length of time it takes to bring about change within policy systems, but also once you have the policies in place, the amount of time it takes for schools to change and then for young people to experience that change. So another key challenge is that this doesn't happen overnight. It can take a very long time. Fran mentioned that psychological interventions often give people an immediate boost, but then with kind of rapid relapse back to baseline. But interventions which aim to change complex school systems at a more fundamental level often do the opposite, perhaps because it takes time for change to be embedded, but also perhaps because it then takes several years for new cohorts of young people to experience their school career under a reformed environment. So Fran mentioned the inclusive trial, and at 2 years follow-up, there was no evidence of effect of that intervention. Had the team stopped there, it probably would have been kind of added to the scrap heap of ineffective interventions, but they made an upfront decision to follow up in the longer term, recognising that change takes time. So at 3 years, there are convincing effects for bullying, mental health, positive wellbeing, substance use, contact with police. So I do often wonder kind of how many interventions, which could make a huge difference to young people's lives, do we throw away because they didn't work fast enough? Another thing that the inclusive trial demonstrates well is how interconnected many of the issues challenging the wellbeing of young people are. So there's huge literature out there on single risk factor interventions. I don't think that that's necessarily been helped by the persistence of kind of medical model approaches to evaluating social interventions, in which there's an expectation that interventions will have one clearly defined single primary outcome. And there's a tendency to kind of take an intervention that's worked for one outcome and adapt it for another and then another. But in reality, in the real world, kind of what school's ever going to have the capacity to deliver one comprehensive intervention for every individual issue that their learners are facing? So the inclusive trial is an example of an intervention which targets common causes of a diverse range of wellbeing related outcomes. And we know, for example, as Fran was saying, that if we improve young people's sense of belonging to their school community, this will be beneficial for their mental health. In doing so, we also strip away the need for young people to engage in alternative and counter-school forms of bonding and identity like smoking. So this graph shows some unpublished data from the 2019 Shern survey in Wales. We can see that among young people with few mental health difficulties, about 1 in 25 leave school as smokers. Amongst those with very high scores on the Strengths and Difficulties questionnaire, that rises to about 1 in 6. So if we want to meet targets of, for example, UK nations becoming smoke-free by 2030, while also improving young people's mental health, there are joined up ways we can think about those things. So Wales has a long history of adopting complex systems approaches to public health, including, but not exclusively, via education systems. So the Welsh Network of Healthy School Schemes, for example, was launched in 1999 following the 4-year pilots of the European Network of Health Promoting Schools. And a network of regional healthy school coordinators works with schools to help them in kind of embedding health and wellbeing into schools and becoming healthy schools. Wales has made some of the strongest policy commitments to moving towards consideration of health and wellbeing in all policies, for example, via the Wellbeing and Future Generations Act. And in this context, the past decade has seen increasing movement of mental health, and in particular, young people's mental health up the agenda. And this is by no means a comprehensive overview of key developments in this time, and there will be people on this meeting who have been far more involved in some of these developments than me. But the Welsh Government's 10-year cross-governmental strategy, Together for Mental Health, was launched in 2012. Together for Children and Young People programme was established in 2015. In 2018, the Mind Over Matter report focused on the kind of step changes needed in emotional and mental health support for children and young people in Wales. That same year, a joint ministerial task and finish group on a whole school approach to mental health and wellbeing was established, which included my co-lead on the Wolfson programme, Simon Murphy. In March 2021, as schools were kind of reopening following a second round of partial closures, new statutory guidance was issued on embedding a whole school approach to emotional and mental wellbeing, which, as we've heard, kind of intersects with other major developments within the Welsh education system, such as ongoing major curriculum reforms to be introduced in a phased manner over the coming years. So there are some big changes ahead for schools. And as I mentioned earlier, this is kind of coming at a time when schools are under a lot of pressure to kind of focus on kind of securing things for the here and now.
Just a few minutes left, Graham. Thank you.
Sorry, one more slide. So last year, the Decipher Research Centre, another centre that I'm connected to, which collaborates with Wolfson, last year were commissioned by Welsh Government to undertake an evaluability assessment of the whole school approach to emotional health and wellbeing, developing a theory of change and considering options for evaluation. And this was led by my Decipher and Wolfson Centre colleague, Dr. Rachel Brown, and it was published on the Welsh Government websites week before last, I think. So Fran's already can provide it in terms of where young people's mental health is in Wales prior to framework implementation. Fran's already provided some data from elsewhere in the UK, but these are some figures from our School Health Research Network surveys in primary and secondary schools. And on the left, we can see that in 2019, if we combine those two bars, roughly 1 in 6 children reported either slightly elevated or clinically significant emotional difficulties. And this has risen quite sharply to around 1 in 4 through the course of the pandemic. In secondary schools, we've only just finished our 2021 surveys, and those data are being processed at the moment. But our 2019 data tell us that around 20% of young people in secondary schools were reporting a very high number of difficulties on the Strengths and Difficulties questionnaire prior to the pandemic. We know there were huge pressures on young people's mental health before the pandemic, which will have been worsened by it for many, and that's the kind of context in which this kind of school change is occurring. So at the moment, in terms of next steps within our work stream of the Wolfson Centre, we'll be kind of building on the evaluability assessment work and sort of developing a protocol for a national evaluation of the implementation of the whole school approach, and also what it means for children and young people. So taking advantage of the kind of unique data infrastructures we have available to us in Wales to monitor children and young people's mental health and wellbeing over time. Obviously, it's going to be challenging to separate effects of the framework from recovery from COVID more broadly over the next couple of years. But the work's also going to involve kind of in-depth process evaluation to understand how these new approaches are implemented in practice, how they're adapted to their context, how they fit with what schools are doing already, and what's displaced in order to kind of make capacity for new ways of working. So that's
Oh, perfect timing. Thank you so much, Graham. Thank you very much indeed for that. So I think we just got literally a couple of minutes. I can't see any obvious questions here. I can see that Tim has put in some comments here. Here we are. So children and young people spend 45 minutes of every waking hour outside school. How do we ensure that the contribution of community organisations and families are properly harnessed? I don't know if you want to have a go at that one, Graham. And then Nikki Jones has asked a question: has work so far fed into PGCE courses in Wales? Because, you know, these developments really getting in at the root of preparation, teacher preparation. So perhaps I could come back to you on those points, Graham.
Yeah, so the first one around community organisations. I mean, I think with the whole school approach, the school itself is often seen as kind of at the centre of its community, but the intention is for it to kind of build kind of links and connections to kind of wider kind of service providers within that wider community. So that is the whole school approach. Doesn't mean that action starts and finishes within the school. In terms of the second point, I believe that there are kind of revisions that have been ongoing for the PGCE. I mean, it is challenging because obviously schools are going to be undergoing these major curriculum reforms from next year as well. So obviously teacher training has had to be updated in order to kind of reflect some of those changes, and that won't just be through PGCE, but also through continuous professional development, because otherwise you'd have to wait kind of decades until all of your teachers were kind of trained in the new ways of working. My wife recently retrained as a primary school teacher, and she did that just before the new curriculum was launched. So should be kind of learning new ways of working, having just trained under the old system. But yeah, I mean, I don't have a lot more to say on that one. But
yeah, lovely. Thanks, Rome. And I think that question from Nikki draws to my mind, which is probably a whole other seminar session, well-being of teachers. Certainly in the NHS, our big focus has been on well-being and engagement of healthcare professionals, leading to better outcomes for health. And without wanting to make a massive leap, you know, the sense of teacher well-being as well. So maybe that's another day, but thank you very much for those questions, and huge thanks, Graham, for that presentation. Really helpful. We will be sharing the slides, and if there are any further questions or comments, colleagues, please do put them in the sidebar. I'm handing over now at this point to Sally, my co-chair. So I just want to say thank you very much to Fran and to Graham for getting us well underway with this, and therefore hand over to Sally for the rest of the session. Thank you.
Diolch, Carol, and yes, I think that these talks complement each other nicely, because I'm really looking forward now to hearing from Liz Gregory, who's going to introduce the NEST framework, which really encompasses a lot of what we've just been hearing about systems and recognising the need to change whole systems. And she will be followed by Gemma Burns and James Corden, who are going to explain how they've been trying to implement this in Gwent. On both Nikki and Tim's questions, just to say that there are work streams, subgroups looking at these things, I believe, in the Ministerial Task and Finish groups, so they are recognised as key points. Okay, so I'm going to go straight over to Liz to start.
Thank you. And it's such a pleasure to be here this afternoon at this joint event between T4CYP and the Wolfson Centre. I think both T4CYP and the Wolfson are fully committed to making sure that we put evidence into practice, and we use practice to help shape our evidence and research. So it's been great having these first two presentations. I think they lead really well into the whole system approach, which is what I'm going to be talking to. And I hope that that really answers Tim's question. I know Tim's been very involved in the process of developing this work. I've had a notification that my sound might not work, so I'm going to look at you, Sally. You're the only person I can see when I eventually get to play the animation, and you can let me know if it's working or not. Okay, so I'm going to be talking about the NEST framework, What is it? Well, it's a planning tool to ensure that mental health and well-being is at the heart of all services and to create a whole system approach. And we've been hearing about the importance of schools, how much time children spend in schools, what a key part of supporting their mental health and well-being schools and the whole school community is. But we've also been hearing about how much time children spend outside of school, but also that schools need to feel connected. And that's exactly what the whole system approach is, that schools can't do this on their own. And where do they fit in the wider system, and how does the wider system support the work that we do? So I'm just going to hopefully play the animation and look for Sally's thumb to come up once we know that it's working.
A little bird has been spreading the word all about the NEST framework, a planning tool designed to help services make sure that mental health and well-being is at the heart of everything they do. It's for everyone, babies, children, young people, parents, carers, and their wider family and professionals, to make sure they feel supported and get extra help if needed. Time was taken to talk to lots of people and listen to their ideas. It was agreed that nests were a good way of explaining what helps children of all ages to grow strong, aim high, and be the best they can be. This happens when their everyday relationships feel nurturing, empowering, safe, and trusted. Everyone's nest is unique, made up of the people who are closest to them, the things they enjoy and help them grow, their communities, and the places they go to in their day-to-day lives. Trusted adults play a vital part in a young person's nest. They can lift them when they are sad, encourage them to try new things, help them join in with others, and make them feel valued and cared for. This is the everyday magic that builds and maintains positive mental health and well-being. The NEST framework aims to organise services so that more people get to experience this everyday magic in their daily lives. It also aims to help children and young people feel a sense of belonging, which is so important to mental health and well-being, whether that is at home, in school, at a club, with friends, or in their community. And when things aren't going well, like when a child or a young person is feeling sad, anxious, left out, or so angry that they push people away, the trusted adults who know them best will have access to support, giving them lots of ideas to try and the confidence to keep helping. That's because sometimes what a young person needs most is for trusted adults not to give up. NEST recognizes how important trusted adults are. When they are well supported, it can make all the difference. Sometimes, of course, extra help is needed, and the NEST framework's no wrong door approach recognizes that everyone is different and there should be lots of different types of help available. That way, all services come together to work out who can best meet the unique needs of each person. This makes sure children and families aren't bounced around services and gives access to the right help at the right time in the right way for them. We all need different kinds of help at different times along the way. The NEST framework aims to support children of all ages, parents, carers, their wider families, and the professionals who help them. It's about making sure everyone has opportunities that are nurturing, empowering, safe, and trusted. Learn more about NEST today.
Okay, so hopefully that gives you a bit of a flavour of what NEST is all about. It was co-produced. It's taken over a year to develop, and I think over 230 hours of co-production has gone into it. And we've obviously spoken to young people, parents and carers, and stakeholders across a range of services to pull the key elements together that they felt needed to be included if we were going to support mental health and well-being for our children and families and wider communities. So the logo was co-produced too, and young people were really clear that they didn't want a picture that captured them at a particular point in time, but rather something that was inclusive and also spoke to the well-being of everybody in a child's community, including parents and carers and the support staff as well, the professionals who work with them. I'm just going to very quickly talk you through the key components. I'm aware of the time and I don't want to eat into the next presentation, which really talks about the whole school approach in practice. But basically, we've got the core elements around the inside, the rights-based approach, equity, diversity and inclusion, values-led, so moving to a strengths-based approach, child development, so moving away from age to stage and what children need across the whole of the domains of child development, and then psychologically informed environments. And we heard about that earlier today, about making sure that our schools are using the best evidence available in how they support all of their work across that setting. Then we've got the core components around the outside. We've obviously got wellbeing across education, which today is all about, and we've heard how Wales is really leading the way in that whole system approach, both with the curriculum, the ALM bill, and the whole school approach framework in there. We've got co-production, which is absolutely pivotal, and child's voice and parents' voice and teachers' voice is critical too, and we'll be hearing more about that later. Then we've got easy access to expertise, and again we heard some really good information about how do you choose what interventions and what advice that you make accessible and available in our schools. Then we've got safe and supportive communities, again recognising school is just one part of a child's life and how school and home and the wider community come together. No Wrong Door, and delighted that Sally Holland is here today, this landmark document that really helps us think about how we close the gaps that children and young people can fall through and feel bounced around the system by. And then trusted adults, and it's been great to hear some of the comments, you know, recognising the value of those relationships, and we're going to hear more about that later. And then who, so we've got parents, carers, children and young people, health, social care, third sector and education. That's the point of a whole system approach. It's all of us. And then the nurturing, empowering, safe and trusted. And again, those core qualities come through in the evidence that we've been hearing about. One of the questions we often get asked is, where do you start? And of course, there's the macro, meso and micro. And again, we've been hearing about how strategy meets practice, and we're going to hear more about those day-to-day interactions being the things that actually make the biggest difference to children and young people. We often talk about changing the culture around children's services as feeling a bit like turning the tanker, but we're actually in Wales making huge progress, and we like to think about it as a flotilla, and there's lots and lots of boats already turning in this direction, and some real big liners in the water with our new curriculum, the whole school approach framework, the policy and the strategy that we've been hearing about today, pulling us in this direction. So I'm going to just say, you know, that these are the key elements. Are we developing things in partnership? Are we developing things in response to need? Do we really align with No Wrong Door and kind of move the barriers and the thresholds that have often led to children and families falling through the gaps? Are children and families at the heart of what we're doing? Are we really drawing on creative and innovative developments? And do they take the whole person into account? So that's all I want to say. For those of you who don't know Helen Ranson, she's the person to know if you want to join our mailing list, and of course follow us on Twitter. But I'm going to hand straight over now to Dr. Gemma Burns and Dr. James Corden, who's going to talk about the multi-agency whole school approach implementation team that we've developed as part of our CAMS transformation across Anaya and Bevan.
Thank you, Liz. Thanks for handing over. I think James is just going to share our slides now, so bear with us while we load up. There we are. Lovely. Thank you, James. Okay. Lovely to see everybody here today, and we're really pleased to be able to kind of join with you to share some of the work that we have been doing together. I think someone's just spotlighted me, which has meant that I've lost all my notes. Could I exit that? There we go. Hang on. Okay, that's great. Thank you. As Liz has said, my name is Gemma Burns and I'm a consultant clinical psychologist, and I'm joined by my colleague, James Cording, educational psychologist, who will be chatting with you guys a little bit later in the presentation. So as Liz has said, we're a small multidisciplinary team of educational and clinical psychologists who were originally funded by the CAMS Transformation Grant in Gwent. And the core purpose of this team at the outset was to develop a whole school approach model, which could be evaluated and adopted in schools in Gwent. And our hope today, in a very brief snapshot, is to share this journey. It is an overview. So we really want to encourage you, if you'd like any further information, to just get in touch with us. Our presentation aligns very closely with the NEST framework, and Liz has talked through that, so I won't linger too long here. But I think what it's fair to say is that the Gwent whole school approach is very focused upon the well-being across education element of the NEST. But these elements, as I'm sure you guys are aware, have many interdependencies. And so this project also aligns with many other important elements of NEST, such as the importance of trusted adults, creating safe and supportive communities, earlier access to expertise, and also co-produced innovations. So as we go through this presentation, it will become clear that that's kind of key to the model. What we want to do today is really share with you some of the stories of the people in the schools that we've worked with. And I think what I want to do is just take a moment to say we're very grateful to the young people in the school communities that have worked alongside us, and that they've given their full permission for us to share some of that footage today. So we'll be pleased to share that with you. Okay. So as mentioned previously, I just want to share with you the kind of journey really from inception to action and all of the stages in between. As you'll learn as we go through today, a central component of our model is listening to and sharing the voices of the school communities that we've worked with during this project. And we're hoping that during the time that we have today, we can present a snapshot of these voices. Okay, so let's talk a little bit about phase one. So as people have already mentioned today, the 2018 Mind Over Matter inquiry highlighted that schools played a central role in the lives of young people and were uniquely placed to support wellbeing alongside other partnership agencies. So fast forward to 2021, and we can clearly see that wellbeing across education is a central component of the NEST model. But what does this actually mean in practice? How do schools and partnership agencies operationalise this important aim? For those of you here today that work in education, you will be acutely aware of the need to support the well-being of both staff and pupils, and that the well-being and mental health landscape has become a very busy marketplace. I think Graham's referred to this already. There are now many different interventions, different approaches and training, and Fran has kind of shared some of the evidence base for those with us today. But it can be a very challenging task for school communities to know what they need in order to support the wellbeing within their own communities, and also to ensure that this is a whole school approach rather than a bolt-on to business as usual. At the start of the Gwent Whole School Approach project, we were faced with many similar dilemmas. What is a whole school approach? What should it include? How should it be measured? What difference is this going to make? And a review of the literature base at that time indicated a number of points that feel important to share today. And I think, you know, people have alluded to this already. There's little evidence-based work on whole school approaches to address well-being. I think it's also important to highlight that this term well-being is now commonplace and widespread. And in that regard, it can mean both everything and nothing. And it's a term that's often used interchangeably across policy and practice guidance. This diffuse policy and practice guidance has often contributed to this misunderstanding and confusion for schools. Essentially, what we were learning from the evidence base is that schools are complex and unique systems, and that no one size fits all. These complex systems require complex and unique approaches which fit the individual needs of the community. The evidence base, which Graham has already referred to, suggests that whole school cultural change takes time. It needs to be at every level of the system, and it's certainly not a quick fix. So it became clear to us that creating communities that attend to everybody's well-being is not something that we could impose upon a community, but it was something that needed to be created by the community in service of the community. With this in mind and in line with the NEST model, we wanted to ensure that the approach we developed whilst drawing on psychological principles was also co-produced with school communities. So we had to start by asking school communities what was important to them. And these listening exercises became fundamental in underpinning our model going forward. Before we go on to kind of what the school said to us, I would just want to take a moment to pause and just to share with you that at the start of the project, we reflected on our experiences, both as students and also as professionals within school communities. And we drew upon what factors we felt impacted on our own well-being, but also the well-being in school communities that we saw in our day-to-day work. And it was through these early discussions that we developed these guiding principles. And I won't read them out for time purposes, really, but you can see them there on the slide. So equipped with these principles, we headed off into our school communities to learn what they had to teach us about whole school approaches to wellbeing. Over to you, James.
Thank you, Gemma. Thorda, good afternoon, everybody. So we visited schools between December 2019 and March 2020. Where we were fortunate to be able to interview pupils, families and school staff about their wellbeing experiences within their school context, and about what made the difference to them. We took a film crew along with us, and from this work emerged our whole school approach film that many of you may have seen. We'll share parts of this film in some short clips with you later this afternoon as well, for those of you who haven't seen it. Over 130 pupils, parents and staff shared their stories about the differences that school communities make in meeting the wellbeing needs of their members in these initial exploratory stages of our work. And these stories have really stayed with us and informed the development of this project. Importantly, these are often the smallest things. They're the things that can easily be overlooked, but which make the biggest difference. They were stories that made us smile, stories that made us think, and stories that moved us immensely. We wanted to share a couple of quotes which have become a powerful metaphor for us. And many of the pupils, like those pictured here, spoke of falling and knowing that they would be picked up and taken care of. Often a physical act after an accident on the yard, but a powerful metaphor for the difference that a school community can make towards well-being, and a powerful steer for the work of our project. So how do we develop school communities that are there to catch us when we fall? Because we all fall. It may not be a physical fall, but things happen in our lives that affect how we feel and how we are doing. We are school communities, how school made a difference to their well-being. So the filming exercise in schools left us with over 100 hours of film footage. We were able to conduct a thematic analysis on this material, from which 5 core themes emerged. And we'll talk about each of these themes in turn this afternoon and share with you some of our film clips. We don't have time today to share all of the clips around each of the themes, but we can make these available to you if you do so wish to see them. We will firstly talk about safety, and research speaks to us about safety as the foundation for higher order psychological processes and growth. And this was really clear from joining with school communities to hear about the factors influencing well-being. So in order to learn, we need to be able to be curious, and in order to be curious, we need to feel safe. But more than this, safety has a real bearing on attendance and engagement. So at its most basic level, if a pupil does not feel safe in their school community, they are not going to attend. And if a staff member doesn't feel safe, they will be looking for other employment. And when a parent doesn't feel safe, they are unlikely to engage. So when thinking about the stories relating to safety, we noticed that these tended to fall into 3 distinct areas of equal importance, which you can see here on the screen. So we've got physical safety, emotional safety, and relational safety. And we've heard many stories about the things that schools do to support safety for their communities. So providing regular supervision for staff can support both emotional and relational safety. Ensuring that all areas of the school feel safe and welcoming is important for physical safety. So having toilets which feel safe to use is always an important one in terms of physical safety for young people. And above all, creating contexts where people are safe to be vulnerable, to take risks and to be themselves was a key message we heard from parents, staff and pupils alike. So let me just show you a little one of our clips of from our film, where our people talk about safety. Sit back and watch this for a moment. So some lovely examples of how schools create safe contexts for the school communities there. Okay, so our next theme we're going to explore is this idea of love and care. And it shouldn't be surprising that love and care being expressed within communities came up as something central to emotional well-being. But we've noticed a challenge to the use of this term, love, within educational contexts. And we debated using this word and even expanded the heading of the section to be love and care rather than just love on its own. However, what we heard consistently through the stories was just how it feels for young people to feel that they are loved, lovable and cared for. And it makes a difference and potentially opens up an important dialogue within school systems. We heard about specific ways of demonstrating this within school contexts, showing members of the community that they are valued, that they are loved and lovable by holding them in unconditional positive regard, which is about seeing them in a good light, regardless of how they've come to school that day and wherever they're at. So as well as these stories of pupils, there were some powerful stories shared by parents in relation to those experiences. There was also this idea of pedagogical love, which is a specific teaching attitude that consists of trust in pupils' learning capacities and desire to help pupils improve their abilities and talents. Love is also shown through having clear rules and boundaries and being strong, calm and reflective enough to stay with the child's intense feelings without breaking down in any way. So, like with safety, we'll show you a short clip now of some of those examples of how this was illustrated in our film. I just saw a comment, someone's having trouble seeing the film. I think there's a little button you've got where you can navigate to the current slide. That's probably what's happened. You've knocked yourself out of sync with the presentation, but I'll start playing this for you now and hopefully that will resolve it for you. Oh. Sorry, it's
It's not happy, is it, James? I'm not sure what's happening there.
Somebody keeps taking control of the presentation.
Ah, right, okay. Can we ask people not to kind of touch anything on their screens while the videos are running? Because I think when you take control of it, it stops the presentation for everybody else. James, I'm thinking that we probably need to move on to belonging, and people will know for next time not to kind of take control when the films are running.
I think I've been able to stop that now, Gemma. So
okay, all right. Let's move on to belonging.
Let's move on to belonging. So the next scene that we're going to look at is belonging. And we heard the importance of the need to feel that you belong expressed through many of the stories and experiences that were shared. So many of the young people and school staff that we met compared their experiences of school as feeling like a home or being part of a family. Schools were more than just a school, and they are themselves a community. The theme of feeling like you're a part of something, that you truly belong and feel connected to your school community appeared central to the experience of well-being in schools. And these were enacted in so many ways, both large and small. And it was really encouraging to hear that had come out in the research that Graham was talking about earlier, as well as being a real protective factor for promoting well-being in schools. So what we came to understand that is a sense of belonging is created through relationships. Belonging does not occur in isolation. It grows when schools place a value on relationships. It is also a theme about feeling seen, about seeing representations of yourself through the community. And when we think about the NEST framework, we are speaking to the importance of safe, supportive communities that value equality, diversity, and inclusion. So when we think about the importance of belonging in comprehensive school, where just the sheer size of the community can make belonging difficult, We were reminded also of the value of holding in mind some of the developmental stages that occur during the adolescent years in terms of social identity. One significant transition occurs as a shift from your sense of self and sense of belonging being primarily influenced by familial influences to being more heavily influenced by your peer group. And we heard stories of comprehensive schools who had worked hard to create smaller communities within the wider community, allowing for everybody to have a place. This was often driven by pupil voice. An example of this being the pupil who started an LGBTQ+ group for themselves and for their peers. So another theme then that emerged was efficacy. Efficacy was prominent and aligns with Bandura's definition of self-efficacy, which is the belief in one's capabilities to organise and execute the courses of action required to manage prospective situations, and a person's belief in his or her ability to succeed in a particular situation. A context that promotes efficacy communicates a belief in a person's ability to have positive control over their motivations, behaviours, and social environment. And this is exemplified in opportunities such as having choice and involvement in decision making. It is a context that communicates support to achieve goals and where goals are encouraged and nurtured. Right, okay. Let's try this bit of film then. Nobody touch anything. Hands on the desks. Okay.
Yeah, everyone put your hands up.
Okay, and I think it's always worth setting some context there. The young lad in the purple blazer who was talking about being able to work from home, that was long before, well, it wasn't long before, but it was prior to any lockdowns came in. So he was really leading the way in terms of some of his, the way he was able to work from home on that. So yeah, it was March 2020 we finished that filming. Okay. So we've got two types of collective efficacy to think about then. So we've got this idea of collective efficacy, and that's a shared belief that we all have the capabilities, responsibility and resources to advance our school community. And then we've got self-efficacy, which is where we allow an individual to produce their own future rather than simply foretelling it. So this can be a personal toolkit for interacting with the world and achieving our goals. So if I just draw your attention to this arrow diagram you can see on screen. So interestingly and importantly, as you can see within this kind of bluey greeny diagram, depending on your screen settings, much of the research exploring the effects of teacher collective efficacy are found as collective efficacy increases, student achievement also increases. Okay. So then let's take a look at agency. A sense of agency then is the experience of having a voice, and this is the belief that you will be listened to within your community. It's about feeling heard, being noticed and feeling valued. Being listened to and seeing the impact of this is associated with positive well-being, and for individuals and communities, it is considered that the experience of agency develops character and ability to participate in productive discussions and promotes key skills such as responsibility, collaboration, teamwork and leadership. Therefore, members of the community who experience agency contribute to a strong sense of community within schools. The experience of agency promotes the development of active adults. If your school environment has been one that has fostered a sense of agency, then the result will be a group of individuals who have an internalized belief that their contributions to the world around them matter, and who therefore may be more likely to take active roles in having a voice and promoting change across the context of their lives. So a key element of agency then is this value that we place upon pupil voice. And pupil voice provides pupils with the opportunity to become involved in how and what they learn, and giving them a real say in the issues affecting them, and allowing them to make positive contributions towards the development of their school as active members in a democratic society. And we can really see this, that this notion is supported in the new curriculum reforms, which advocate that all members of a school community have a role in supporting well-being, and it's also at the heart of the NEST framework. So to summarise then, at this stage in the project, we had identified these 5 core themes which were integral to the whole school approach, and you can see them there going from left to right: safety, agency, efficacy, love and belonging. And at this point, I think it's also important then to highlight the alignment of these 5 themes, which we've drawn from the voices of school communities and the values which are outlined within the Welsh Government Whole School Approach framework. So our values, which emerged in the spring of 2020 for our thematic analysis of the film footage, and we've got the Whole School Approach framework, which we published in the spring of 2021. And when that came out, we were really delighted to see that there was a kind of a crossover between the two, which you can see illustrated here. So what we've got then is at the heart of the Welsh Government framework, on the right-hand turret of our castle, are the 3 core values. So we've got belonging, efficacy and voice. And then in the left-hand turret, what you can see is our whole school approach elements. And you'll see that they mirror the framework values. So we've got belonging, efficacy, and the slight difference there at the top is agency, but they cover the same themes. So what we've done then is we felt it was important to include these 2 additional elements of safety, love and care, which we've got on our model here as being the foundations. And those are the foundations on which the 3 other elements really sit. So they enable us to fulfill the other elements of belonging, efficacy and agency. So we've got to establish those first before we're able to fulfill the other ones. So when working with schools in Gwent, we're really clear then that the work we're doing together fulfills this requirement of the whole school approach framework. Okay, Gemma, have you got your take back control button? You have.
I certainly have. Thank you, James. Okay, so at this point in the project, before we move on to the next stage, I just wanted to take a moment to highlight what we felt that we were learning from schools about whole system approaches. So the large majority of schools, and those of you that are amongst us today, will have a list of specific interventions which are delivered to support wellbeing. And it was so interesting to hear Fran talk about some of those interventions and the evidence base there. And examples of which are illustrated within our heart. It's not an exhaustive list, but they're just examples. What we're proposing is that whilst all of these individual interventions perform an important function within a whole school approach to wellbeing, you know, they meet both the early intervention agenda and they also offer more targeted support. We would suggest that none of these interventions in and of themselves amount to a whole school approach. What we're learning is that it's not simply the packages and interventions that are delivered within the school context, which is important. Rather, a whole school approach to wellbeing includes something which is far more unique and difficult to measure, package and standardise. What I'm describing lies within the realm of process rather than outcome. It's the why and the how rather than just the what. In our experience, in schools where communities report positive wellbeing, there is often a clear value base around wellbeing, so the school community understand why it is important to attend to their wellbeing. In these schools, they also speak to the importance of how wellbeing practices are enacted. They describe feeling consulted, valued, having a sense of control, connection, and belonging to a community with a shared endeavour to support wellbeing. This wellbeing agenda is enacted at every layer of the system. Finally, schools also reported that it was not only the planned interventions designed to support wellbeing that made a difference, but it was also the small incidental practices such as taking time to check in with your colleagues or pupils, supporting staff to develop their special interests, promoting human connection, belonging. All of these things made a difference. Essentially, what we're proposing is that for every school community, their puzzle pieces will look different, and the way in which they enact their whole school approach should be relevant to the needs of their community, and it should be at every level of the system. This is important for all members of the community to feel safe, to feel that they belong, that they have a voice, a choice, and that they are cared for. What we want to do now is just share with you an example of a school community that has come along to some of our training and that we've been working with. In Gwent, what we offer to school communities, and I think someone mentioned this earlier, is an opportunity to learn from each other. So there is no one size fits all agenda, but there's opportunities to share learning. So we just want to share with you what we describe as a learning burst, and it's a presentation led by one of these schools. Okay, so I think it's just really interesting to hear what schools are doing with this and how they make it unique to their communities. So phase 2 of the project, and I'm aware of the time, so we will whistle through this. Phase 2 of the project was about supporting schools to develop an approach which would enact these 5 components of well-being within the community. As we've already highlighted, this would need to be unique to the school community. So rather than us develop a one-size-fits-all, we needed an approach which would support each school's individual needs, and an inquiry-based model seemed the best way forward. So why are inquiry-based learning models so valuable within this context? Well, they act as a vehicle to ensure that all voices are heard. They create safe structures for members of a community to be curious, to share their thoughts on well-being, and to better understand their own strengths and challenges. In addition, during the course of our work, we've heard school communities say that just knowing there's a commitment to understanding well-being and just being asked how they're doing can have a dramatic impact on people feeling like they're important, that they matter, that people are interested. As such, the enactment of an inquiry can have a positive impact on well-being before any specific learning or action has come out of the inquiry. Okay, I'm going to hand over to James just to briefly explain the spiral of inquiry. James, you're on mute.
There we go. Always one, isn't there? So the model of inquiry that we've adopted was originally developed in Canada by Timperley, Kaiser and Halbert in 2014. They advocate that they've got this lovely quote: innovation floats on a sea of inquiry and curiosity is a driver for change. And this leads us to considering 3 big questions that underpin the stages through the inquiry process. So whatever instigates the spiral, all inquiries will need to hold in mind these 3 overarching questions, which we can see here. So first of all, then, what's going on for our community in relation to well-being? So this question will continuously prompt us to check that knowledge about the well-being experiences of school community members is driving our inquiry process. The question is about inclusivity, and it ensures that all voices and experiences are captured within a spiral of inquiry. So by asking this question of the whole community, we are ensuring that the information gathered is representative and meaningful. The second question, how do we know, helps to ground the inquiry process in evidence. So everyone will have an opinion, no doubt, about what is going on within the school community. And we need to make sure that we have rich sources of evidence to back up our opinions. We know that within school communities, academic outcome measures are used to drive understanding about a school's performance. And while valuable, this data has the potential to miss the well-being needs of our school community and its influence on academic outcomes, attendance measurements, and staff turnover. So when we look at what's going on for members of our school community in relation to well-being and explore this from a curious and open position, we have the potential to gain a richer picture of the needs of our community. So the third and final question that we need to hold in mind ensures that we are is why does it matter? So this ensures that we are connecting with the importance of the issues being raised by our school community, and it enhances our understanding of what is being raised and guides us to a reflective position within our explorations. It helps us to consider the impact or effect of the issue on different members of the community. So this is it. And this is, if you've not seen the actual image of the spiral of inquiry, this is it here. And the beauty of the spiral is that it's built on evidence-based concepts that you may already know and practices that you may already use. So it's not asking you to completely overhaul and start something new, but it tries to draw upon what you might be doing well already. There are, however, features that distinguish this spiral of inquiry from other forms of action research, and I'll explain these now. So it's a collaborative and creative approach across the whole school community, and that's seen as being vital, and that emphasises the importance of capturing everybody's voice. It starts with a deep understanding of aspects of well-being and the experiences of community members in relation to these, and it is specifically designed to influence the experience of well-being for everybody. It respects the judgment, experience and language of everyone in the school community, And working together on a spiral of inquiry in relation to wellbeing in your school community creates the conditions where curiosity is encouraged, developed and sustained. And this is essential to opening up thinking around changing practices and creating innovative and ultimately fulfilling approaches to emotional wellbeing in your school communities. So then the nature of the spiral shape, constantly swirling upwards, is an important one, and it represents a continuous process of development and working alongside our communities as they change and develop. And it moves us away from artificial linear ways of thinking, which might limit ideas and the needs of our community. And it really enables us to think about, it really enables us to encompass the needs of our communities and ensure that they're fully achieved through this inquiry process. So it's
James, just a few more minutes now, if that's okay, so we've got time for some questions.
That's right, we're almost there. So a further value of the spiral is that it's a model that is considered flexible, and it can be used broadly for any aspect of wellbeing work. So I'll just quickly show you this. We've got an example now of one of a head teacher of a special school talking with Ian, who's one of our psychologists, about their experiences of using the spiral. Okay, that's some lovely examples then of how the spiral's used.
Thank you, James. I think time has slightly got the better of us because I think we started slightly late. James, I don't know whether you want to just very briefly talk about how it maps onto the framework, and then I'll just finish off.
Yeah, sure. So
there are no questions at the moment in the chat. They're just lovely comments. So you've probably got 5 minutes if you want to, then we'll go straight into the break.
5 minutes. That's enough. So okay, we'll skim over this one. What you're seeing here illustrated in front of you is how the spiral of inquiry aligns with the Welsh Government framework. So in the kind of peachy colour you can see there, those are the stages of the kind of inquiry model that the Welsh Government framework is advocating. So you've got your scoping stage, which lines up perfectly with scanning. You've got the taking action stage, which lines up with the action plan phase of the Welsh Government framework. And then finally, the checking stage, which links in with the evaluation stage. What the spiral does is it sort of encourages us to kind of slow down and kind of have a deeper consideration and take a few more steps to really understand the issues at play, but fulfills all those elements of the framework, but just in by having a much greater understanding of what's going on in terms of well-being in a school community. There we go. Gemma, I'm going to hand back to you now, I think. Oh, you're on mute.
Thank you. Okay, so phase 3 of the project is where we are now. We've trained about 150 schools within Gwent on this model, and we're kind of providing ongoing consultation to some of those schools around their inquiry-based learning model. And you know, I think what is key to this is actually, you know, thinking back to that 2018 Mind Over Matter report about how do partnership agencies support school communities with this work. And we feel the spiral kind of beautifully lends itself to that work, actually, that partnership agencies have a role to play in both supporting schools with their scanning, but also joining schools in the learning and taking action phase of their spiral. So in the language of the NEST framework, this kind of allows early access for expertise, but it's access to expertise which is kind of very specifically based around the needs of the school. Okay, very briefly, there's just some evaluation feedback, which I feel a little embarrassed to read out, so I'm just going to click through them. There we are. That one's quite difficult to read with those background colours. Okay, I want to just finish off with a very short clip of a colleague of ours, Charlotte, who is a clinical psychologist, just summing up the project. But thanks ever so much for the time. We've really enjoyed sharing our work today. Sally, can I just say we're in the current process of producing a Welsh film as well, so that will be made available for people if they're interested.
Thank you very much. And, you know, there's some lovely comments in the sidebar for you to look at your leisure now, with strong feedback and a really good, a really interesting question actually from Nikki Jones about whether Spiral could inform Eston approaches. I know that Eston are really rethinking and rewriting their framework around the new curriculum and how they work with schools and young people in schools to drive school improvements. So I think it's a really good idea, and I don't know whether Gemma or James want to come back quickly, but it's certainly something that I think it's worth taking to Eston.
Certainly, Sally. Interestingly, the Spirals of Inquiry model was actually developed as an inquiry-based learning model into children's learning. So we have adapted it to specifically be around well-being, but you know, in terms of the core purposes of the new curriculum, an inquiry-based model in terms of asking young people and really helping them to kind of become active and, you know, involved within the design of the education curriculum, it certainly does lend itself to that.
And we've come across examples in our practice where there's a number of schools we're engaging with at the moment who have got experience of using the spiral around more academic sort of focuses. So they've been able to kind of adapt and slot into using the spiral for the wellbeing purposes really easily. So there's a lot of work that's already gone on out there around the spiral in school improvement, and it's just changing the focus to look at it through those 5 elements of wellbeing.
Just very briefly, there is a Spirals handbook that has been written by the original authors that schools can get hold of, and in terms of for the schools in Gwent, we've also written a manual for how you would go about doing a spiral around wellbeing, so we're more than happy to make that available to people. Thank you, James. Just showing a hard copy. So I'm used to see a hard copy of anything these days, isn't it? Thank you. That was wonderful, and thank you to Liz as well for the Nest presentation at the beginning. We're going to take a comfort break now. Hopefully you've taken comfort breaks as you've needed them in this environment, but we gives us 10 minutes to actually allow for our wonderful artist Emma to share some images as well, whilst people also hopefully put the kettle on at this stage. When we come back at 10 past, Bex is going to describe to us and tell us about the discussion groups, which we're going to go into after that. And you'll need to be on Mentimeter if you can as well. It's going to require a little bit of multitasking from us. I've tried the link and it's working well for me, but they'll put the link in again so that you don't have to. There's a lot of chat since the link was put in, so I know that the team are going to put the link in again for us during the break as well. So yes, Mark Campion from Eston is very involved. That's great to know. And if anyone's here from Eston, then please do. And I want to say anything in the chat, please do identify yourselves. So see you all in 10 minutes. And I think lots of people's minds are buzzing and looking forward to getting into some discussion. I know we've had to lose some people, including parents and carers going for school runs, but there's enough of us left to have some really good discussion after the break. So I'll see you in 10 minutes. Thank you very much, everyone. Don't forget to look at the art during the break. Keep your screens on.
It's wonderful to see your illustration. Are you able to zoom in at all? I know I've seen you do that in presentations before. Great. Thank
Brilliant.
you. I love the way you managed to get everything on a page. If only we could all write reports like that. So welcome back, everyone. I hope most people have had a chance to boil the kettle, if not stick their head outside for a minute and breathe in some fresh air. It's now time for us to have some small group discussions for 20 minutes. If you don't want to participate in a breakout room, you can just return to the main meeting room, but I hope that people will be able to enjoy having.
So as you can see, loads of fantastic responses from everybody. Thank you.
That's really good to see. I mean, some of it's about how people, I think, felt personally on listening to the talks, and also there's quite a lot. I'm just looking for my glasses so you can see it more, see them more clearly, but also people's views about you know, what's important and what needs to happen next. I don't know if anyone else was like me when they were typing in, but I found the 25 character limit quite hard. We were having quite a rich, in-depth discussion. It was quite hard to summarize it, but people have done a really good job of it. I am wondering whether, I don't know how many groups we were, and I don't think we have I don't think we have time to hear back from each group in any detail, but Helen, are we going to just invite one or two people who particularly want to share something that was said in their group to speak now? We've got a few minutes to do that, and perhaps even explain what some of these words mean. Is anyone feeling brave enough to stick their hand up now and actually explain a bit about what was said in their group? Yeah, a couple of other people had difficulties like me with the small group. I was able to hear, that's good. Anyone feeling brave? Well, I have to nominate someone. Can't see any hands up just now. Oh, Liz, thank you very much for coming to my rescue. Would you like to say something about your group?
Absolutely. Yeah, my mic's off. Yes, we're having lots of little quirks with teams today. But we had a very small group, but it was perfectly formed. And I think that what came across really strongly in our group was that this is about everybody in a school community. It's about teachers, parents, and of course, children and young people. And there was also a lovely sense of wanting to go back and share it immediately with school communities that people had come from, which felt really exciting. But also, I suppose, another strong message, and my group can join in if they want to add any more, but there was something in there about being open to listening and being curious and really hearing what children and young people have to say and trusting that came across really strongly as well. So those were the main themes, I think. And also that we're here as you know, parents, professionals as well, and often wear both hats, and just the reassurance that Wales is heading in this direction, and a bit of an acknowledgement that this probably wouldn't have happened 5 years ago, that this does feel in and of itself like a cultural shift, that we're privileging these things and talking about them, and that there's a real momentum across research and policy to drive it forward.
Thanks very much for that feedback. That's really helpful. And we've also had a comment in the chat about the voluntary sector role as well, and the third sector. And I think that fits with some of the evidence we heard at the beginning about how sometimes a fresh face and an expert face coming in can really make a difference. And while I just wait for the next volunteer, just to say that in my tiny group, there are only 3 of us, we'd also had that discussion about we feel a bit of a turn of conversation, and obviously lots of people in this room have been part of that. But nationally, I think that the whole nation approach, I think I spotted, which came from our group. So it's not just a whole community approach, but we do feel we're seeing a bit of a whole nation sign up to this here in Wales, and that conversations have changed. I know when I first became Children's Commissioner, I was certainly told, you know, by very senior people, including cabinet ministers, that, you know, schools were for teaching and learning and not for counselling, social work, therapy, mental health, etc. But I think that changed very rapidly, actually. And you know, I think all the people who work in schools know that you know it is the bread and butter of what you do, and without children's well-being being attended to, which you've always done, you know, how can children be ready to learn, and our teaching staff ready to teach as well? I'm looking to see if anyone else wants to contribute. So I've got Elizabeth Dennis.
Yeah, I thought I'd be brave and stick my hand up as well. We had a really good discussion in our group of lots of different things, and I think a lot of things that you guys already touched on, but we also talked about the importance of leadership like both in schools and out of schools, and how key that is to that kind of culture and ethos and values. And we also talked about what really struck us was, like, when we had the presentations, was just about how long, isn't it, that, you know, before change can be seen, and how much within our professions we rely on short-term funding, and what a barrier that can be to that then, especially now at the moment. It just feels like there's funding flying everywhere for some really short-term projects to be spent by the end of March. You think if we could pull that together and have that over years, like what a difference that would make. So yeah, just to add that, really, thanks.
Thanks very much. And we also had that discussion about funding ending in March. So every year it seems to be, we've got this till March, doesn't it? And that's both within schools themselves, and also the third sector, and also some of our cross-agency funding as well, which has funded some of these initiatives, including the Gwent initiative. I'd just like to see now whether, thanks so much for all those contributions. I'd like to see whether anyone's got any questions of our speakers who are still with us. And are there any further thoughts or questions, might be about what next, or what your sort of thoughts about prospects for the future? If I don't see any hands straight away, I think I might just ask to whiz round our speakers. You didn't know I was going to ask you the speakers, but I know you're all wonderfully adaptable people. And ask sort of what, you know, in one sentence, what you think and hope is going to happen next in all of this. Which speaker would like to go first?
I'm happy to give it a go.
Oh, thank you so much.
So I always sort of feel like I need to have the caveat that I've never worked in a school. I have been to a school and I'm a scientist. So, but I suppose in terms of what next, I think that we're at the step, you know, quite a long way away, quite an exciting journey really, and that there's lots of sort of ambition and enthusiasm about trying to find evidence-based but creative ways of embedding an approach to support young people in young people's mental health and well-being sort of more broadly in school, and that's going to be very collaborative approach. But what we really want to ensure and have the, I suppose, the kind of framework and support around trying to help ensure and have the tools to ensure that that's evidence-based and it's also evaluated, and it's sort of thinking about ways of fitting in that and embedding that evaluation, and very much sort of agreeing with the earlier comments about how that needs to be over quite a long period of time and not just short term, you know, looking for short-term wins.
Thank you. I was so struck by Graham's comments about how sometimes we evaluate things too soon and they don't seem to be having an effect at that point. I'll really take that away from that presentation, Graham. I think Gemma's volunteering to go next.
Yeah, just off the back of Fran's comments, really. In terms of the Gwent Whole School approach, one of the things that we were really interested in hearing Graham's comment about kind of whole system approach takes time and it's not a quick fix. And, you know, so grateful that Gwent had sort of taken the time and the commitment to commit to developing a project which really looks at whole system cultural change. But, you know, as is the challenge, often these projects are short-term funded. We've been lucky to have some partial funding for a proportion of the team, so we're really keen to take some of that practice forward. Some of the things that we've talked about is how do we develop a train the trainer model for those professionals who work day to day within school communities to support them in their practice. But one of the things we've heard from school communities is that they need support from partnership agencies to do this work. That inquiry-based work around wellbeing is not something that schools kind of want to do on their own, nor should they be left to do on their own. So, you know, there's a real, I would say there's a real desire to kind of want to continue this work, and we hope that that's kind of reflected in funding that goes forward. I think we've also kind of made connections with Fran at the Wolfson. They were very interested to think about evaluation, and we've been doing some of that evaluation work already, but kind of how we take that forward to ensure that it's kind of a rigorous evaluation framework would be really positive steps forward.
Thank you so much. That's wonderful, and important observations. Graham, did you want to come in with anything about what you would like to see next, or what you think is going to happen next?
Yeah, sure. I mean, I think some of the points I was going to say were kind of covered by Fran earlier, but I think we do need to evaluate, but I think we need to kind of have kind of ongoing reflections on sort of what support is needed to ensure kind of high quality, sustainable implementation, because it would be a shame, having come this far, to see this failed, not sort of implemented well, and that schools don't have the kind of support necessary to do that. So yeah, we need to understand sort of how it takes shape, but we need to be patient and not throw it away too quickly because it doesn't change things overnight.
That's an important point that's come across very strongly today, isn't it? This is not a quick fix transformation programme for us here in Wales. It is going to take time. But I do think there seems to be a general consensus we are on a journey towards it, which is a good sign. Anyone else who spoke today want to add anything? There are quite a lot of comments flying into the chat now.
I just wondered if I could pick up something that Nikki had said about increased need, and you know, we know that there's enormously increased need, and that's sort of across the full spectrum, from sort of well-being to overt mental health disorder in young people, and we're going to need all sorts of levels of service provision. You know, others will likely have things to say about this, but thinking about systems, but also ensuring that young people who really do need external support get that, and find the right door. and we've heard about that earlier on today, but also things, I think, with such sort of great need, that there is also a place for sort of self-management strategies for young people, for parents, for education, for stress management strategies and teachers. And I'll let the practitioners pick that up, but I do just think there's that whole sort of triangle of need.
Thank you. Thanks very much. Liz, did you want to come back in?
Yeah, just in that kind of bigger question that you were asking about what next. I suppose for me in this journey, the coming together across agencies and kind of highlighting and seeing and developing the common ground has been so exciting and so reassuring. So I think more shared forums, more shared endeavours, more joint working, just to keep this alive and to keep the momentum going. But I'd also really support what Francis is saying, that for me it's got to be a both and. It's got to be that whole system, big picture culture, but we can't lose sight of the things that do make a difference in the day-to-day interactions, whether that's formal interventions or informal day-to-day stuff. So how we keep an eye on both, I think, is the task, and not get drawn into one or the other, which I think historically it has been a bit of a risk.
Yes, thank you very much. And hopefully again our conversation is maturing here in Wales beyond that. Thanks, Abby, for clarifying that your question's been answered. A question from Denise about the Gwent project. When did it begin? So how, we've been talking about how long these things take. How long has it been going?
Oh, I'm now struggling with the COVID time warp. Where 2020, 2019? James, help me out.
Summer of 2019.
There we are, summer of 2019.
And timing.
It was fabulous. We had our launch, lots of schools interested, and I think the schools closed the next day. And there's been some positives and negatives in terms of that, in terms of being able to reach schools, in terms of online training. But it really does take time, and a whole system change by its very nature requires people to be engaged and committed, but also to be safe enough to be vulnerable, to learn, to reflect on what they're doing well, but also on the things they need support to do differently. And actually, that's a complex change system which requires support. So it's a long process, but it's been a very, very interesting one.
Thank you. We couldn't have seen more in the during the pandemic. It really did raise public awareness, I think, of how important schools are for children's well-being, and their broader contribution to our children's lives. But just before I bring Andrea in, who's got a question, I think that might have to be our last question. We may have time for one other or comment. I do know that the Wilson Centre and Together for Children and People have got 3 additional specific questions on Mentimeter. Is that correct? It's in my notes. Would you like to put? Is it on the same link as before?
Yes, the last 3 questions we'd like are on the same Menti link and code. So if everybody could, if you haven't already, pop in some answers over the next few days. That link will be live for a week, so plenty of time after we finish today to reflect and add any thoughts that you'd like to share there too. Thank you.
Thank you. That's great. Okay, so you don't need to do it this minute, so we can concentrate on just a few more minutes of discussion. Andrea Meek.
Hi, I work for the National Centre for Mental Health, but I'm also a parent of a child within Gwent, and I'm really, really encouraged by everything that I've heard today. It's been, a huge help. I guess my kind of question is, although I've been encouraged, this hasn't kind of reflected our journey so far. And quite often, although we're talking today about well-being in schools, well-being kind of and mental health trickles into kind of family life as well. So, you know, if it wasn't for kind of learning about this through work, you know, the school wouldn't have approached me about, you know, and I wouldn't have heard about any of this as a parent. So it's just about how everybody thinks that parents can be involved, or, well, not necessarily how parents can stay informed, and how we kind of stop things being tick box exercises for parents, you know, because we're desperate for help, and you know, things like this are really, really useful so that you can learn about things like the whole school approach and you know, the processes that are available in your area.
That's a fantastic question, Andrea, and I'm wondering whether Liz, Gemma or James might want to talk about how you have already, or how you think the parents and carers in the community can be further involved in all of this.
I'm happy to say a couple of words, Liz. I don't know whether you want to add anything in, but Andrea, thanks for your question. I think it's a really, really important point that you raise, and one that's, you know, very challenging in terms of kind of how we ensure meaningful involvement, that families feel that they're at the centre of this process. I think from our perspective, one of the things that happened with the CAMS transformation grant is that we were funded to kind of engage in a very small pilot to kind of proof of concept, if you like. So what we had to do at that initial period of time was identify with local education authorities kind of one cluster within each of their regions. So the work became very focused in that way. So it may be that you've not been made available of that because your school in particular isn't in one of those clusters. But I think one of the things that the spiral does so beautifully actually is it encourages schools to really think about who are the voices that we need to listen to, what makes this meaningful in terms of a scan. And, you know, some of the work that we've seen is actually involving parents in the scanning. So, you know, how do we scan? What questions do we ask? And to really kind of make that deep curiosity part of the process. I think one of the things that I've experienced is how we support systems to be open to have those challenging conversations at time. How do we make it safe enough that we can all learn together, that it doesn't become defensive or closed off or needing to protect ourselves? And that takes support, I think, for school communities to do that in a meaningful way. And so, you know, it's certainly not there yet. I think it's complex work. But I think it's work that needs to be done in order that families and young people feel that their voices are heard and that they're kind of incorporated into those wellbeing plans. So watch this space, Andrea. Fingers crossed the project will be extended more widely, and we certainly do that. The other thing to say is in Gwent we have a Twitter feed, so you can always sort of get involved in that way as well, Andrea.
Thanks very much. James, did you want to say anything really quick?
Yeah, I was just going to add on to that, I was aware of a letter which has gone out to all schools in Newport and Torvine only in the last week, which is highlighting the fact that the whole school approach is now statutory. So schools have received that, and we've already started to see inquiries coming from schools which aren't in our pilot clusters. So the awareness is certainly, you know, it's gaining pace and increasing.
And if we don't involve our whole school community, our work, that children and adults in the wider community, then we're losing out, because, you know, we won't do it as well. We'll do it much better if we work with everyone rather than trying to do things to people, as we all know, and I think everyone here knows that. Right, Luke, you've got the last question or comment.
Thanks, Sally. Yeah, it was a comment based on the question that Andrea just raised, actually. So I'm a service manager for Platform for Young People, and we've recently done a piece of work regarding our parents and carers, because we realise there's a massive gap, as Andrea said, supporting parents, and obviously we can't really do a huge amount of that because our involvement is working with young people directly. As of last week, we actually launched our online Parents and Carers Wellbeing programme. Initially, we thought it was going to be a small programme when we originally set aside 30 tickets, because we thought that we didn't know if many parents across Gwent would be interested in it. We've actually sold out 3 times. We've got over 1,200 tickets sold out, in terms of, just tells you about the demand, in terms of what Andrea you're saying, in terms of parents wanting to know how they can better help and support the young people's mental health and well-being. We've seen a huge response to it. We've got over 200 plus tickets sold out for every event now for the next 6 sessions, which for us as an organisation, we've been blown away. But it just goes to reiterate what you said, Andrea. the importance that how the support is needed for parents too, and to create a safe space online an hour a week where young parents can come together, share their experiences of young people going forward and what they've all gone through. The feedback has been amazing, because they've just come back and said, I have a space to realise that my child isn't the only one like this, and other parents have felt the same and connected. So I think it's the importance of creating those safe spaces, as well as providing that support where people, parents and carers can really align their difficulties and share the fact that we're all human and we all face these same things together. So it's been an influential part of what we do, and we're hoping now to extend this to all young parents and parents out there in the future, if possible.
Thanks so much, Luke. I'm a big fan of Platform and all that you do with your peer work with young people. Could you just put a link in the chat to your website so people can see what organisation that is? It looks like you've untapped a huge need there, and definitely be good to hear about more. Lots of enthusiasm in the chat about the idea as well. So I think it just remains for me to thank very much all of our speakers and organisers for today's event, but also all of you that have attended and taken part with such enthusiasm. This is a journey. We haven't arrived here yet in Wales, but it's great to see people from all walks of life here today committed to moving forward with this. I know that recordings and the visual illustration will be shared with all attendees in the next few days, including a survey as well. And so don't forget to also fill in your questions on the Mentimeter. So on behalf of the Wolfson Centre and Together for Children People, thank you very much. Diolch yn fawr I chi gyd am ymuno ni, a gobeithio byddwn ni'n gweld chi cyn bo hir. Hopefully we'll see you all very, very soon. Diolch yn fawr iawn pawb. Bye for now.
Thank you.
Thank you. Yeah.
Congratulations, that was great.
So I was on mute then, Emma. Thank you ever so much. That went really, really well. Thank you.
Very good. Lots of enthusiasm in the chat, which is a really good sign. Well done, everyone. I'm going to dash now, but thanks all. It was really.
Thanks so much, Sally, for chairing.
Thank
it was
you again,
skillfully
Sally.
done. That was a really packed day.
It's really nice to be actually to chair, because it meant that I stayed and concentrated for the whole thing. It's so easy to dash from one thing to another in life, isn't it? So thank you for inviting me.
Yeah, excellent.
Okay,
thanks ever so
bye-bye.
much. And thanks, Emma. What a complicated thing you had to capture. So much information there.
Yeah, I've nearly done it, so I'll just do a little bit of tidying up and I'll send it over in a bit. So
Absolutely brilliant. Fantastic.
Straight away. Okay, I'll get on with it.
Thank you, everybody. Thank you, James. I don't know if Gemma's gone. She's maybe disappeared. Thanks so much. That was excellent. Really, really good presentations.
Oh, thank you. No, really glad to be a part of it. Thanks everyone for organising that, and glad it all went well.
It did, didn't it? Teams was a little bit naughty. I don't know what was going on there, but
someone hijacked our presentation list.
How did that happen?
You just hit the take control button. If you ever want to set the cat amongst the pigeons in a conference online, just hit that take control button.
Oh, the power, eh? Oh my goodness. But it didn't interrupt it at all. I think you got all the main messages across, and I think that the morning, you know, not